Welcome back to All Things Plastics Podcast. Today, I'm joined by Dr. Andre Marshall, a double board certified plastic surgeon based in Beverly Hills. But this journey started far from the spotlight in Weatherford, Oklahoma. Dr. Marshall earned his medical degree at the University of Oklahoma, completed a rigorous general surgery residency at Vanderbilt, and then went on to train at one of the top programs in the country, the Duke Plastic Surgery Fellowship. He has also had a formative experience shadowing a top plastic surgeon in Colombia. Since 2015, Dr. Marshall has specialized in breast and body contouring procedures, from liposuction and tummy tucks to breast augmentations, BBLs, and a growing area of interest, rib remodeling. Let's dive into his journey from Oklahoma to Beverly Hills and explore the techniques behind his signature body contouring results. Let's welcome Dr. Andre Marshall. Dr. Marshall, welcome to All Things Plastics. You are the first surgeon to be on the podcast, and I feel like it's only right because you did Jasmine's iconic surgery journey.
Yeah.
And she looks amazing. Her results, she's what, a year and a half post-op now?
Yeah, it's about a year and a half post-op.
Yeah, she looks amazing. So I was like, you know what? We have to start off with Dr. Marshall, and we're going to dive right into it.
Let's go.
You've trained at some of the best, OU, Vanderbilt, and Duke. How did each chapter shape the surgeon you are today?
Yeah. I think it's important to diversify anything in your life. It's good to diversify your friend group, your education, your experiences. And so I'm born and raised in Oklahoma, so I had great education there. Went to a public med school, which I'm very glad for because I came out without a lot of debt. And then I went to Vanderbilt because it had one of the best general surgery training programs in the country.
Yeah.
I didn't know I wanted to do plastic surgery, but I knew I wanted to do something in general surgery. So that was the best place for me to go. And you got the best hands-on experience as a general surgeon. And then once I decided I wanted to do plastics, Duke was just such a well-known name for education, for reconstruction. So it was only a natural fit. And, I liked warmer weather, so I wanted to stay kind of in the South. So Duke just made the most sense.
Do you feel having that general surgery background and experience really shaped you to become a better plastic surgeon?
For me personally, I do think it did because I dealt with so much reconstruction and trauma that I've worked everywhere on the body. So I feel so much more comfortable as a plastic surgeon now that I had that general surgery experience. Do I think it's absolutely necessary? I don't, but it certainly helped shape the surgeon that I have become today.
Now, coming from a small town in Oklahoma to Beverly Hills, that is a transition. Were you like, what the hell is going on when you came from Oklahoma? Was it a total culture shock?
I honestly never thought I would live in California. Believe it or not, when I was interviewing for plastic surgery fellowships, I had an interview here in Los Angeles and I just didn't show up because I said I would never live in LA. I don't want to pay rent, $2,500 a month.
Yeah.
I have a roommate. So I never even showed up for my interview. And so after I finished at Duke, my plan was to go back to Oklahoma and do breast reconstruction. And at the last minute, I had an opportunity to do a fellowship in Orange County, near the beach. And I was like, this sounds too good to be true. So I took it, and that's history. I've been in California ever since.
You made the jump.
I made the jump.
Yes,
So,
we're so glad you're here. Now, there are a lot of surgical differences and trends coming from the South, the East Coast to the West Coast. What have you seen, and especially in patient expectations? Because we deal, to be fair and honest, we deal with a lot of people with money. With money, they expect a certain result and to get treated a certain way. Do you see a big difference?
I think wherever you go in the country, you're going to see different trends in plastic surgery. If you're in the South, you're in Texas, you hear that term, everything's bigger in Texas.
Yeah.
So I do notice that you'll see larger breast implants when you're in Texas versus more of kind of a more moderate and conservative breast implant look here in California. Now, OC is kind of the exception there. In Orange County, the implants are pretty big. But I would say in the South, people are not coming in asking for that 25-inch waist. They're not asking to be snatched. A lot of moms just are happy with a little bit of extra skin removal. And so you'll see a lot of tummy tucks done without liposuction. Whereas here, we're dealing with a population that is deciding, are they going to go to TJ or Columbia to get super snatched, or do they want to stay here in Southern California? So I feel like the expectations are a little bit higher, especially in regards to body contouring. So, and there's a lot of competition here. We're in Beverly Hills, there's no less than, several hundred plastic surgeons within this triangle. So the pressure is extremely high in California versus, in the South.
And do you think the patients coming into your practice, getting consultations, do you think that they're influenced by what they see online?
Absolutely. I mean, most people will say, how did you find this? It was either Facebook or Instagram. And when people kind of convey what they want to look like, they'll pull up some Instagram model or somebody they saw online. And so without the internet, plastic surgery today would not be what it is. And so, yes, heavy influence.
100%. Now, speaking on social media and trends, we are going to get into a big one, rib remodeling. Now, some surgeons call it unsafe or too extreme. How do you respond to that criticism surrounding the procedure?
There's a saying, you can't hate from outside the club because you can't even get in.
Period.
So, those hating on it, what is their basis? There was a time going back to general surgery where everyone had the gallbladder taken out open through a large scar. And then somebody invented small little port and laparoscopic surgery, and they said this will never work. And now that's essentially the only way you'll ever see a gallbladder taken out. Anything that's new is always going to be met with controversy, no question. I would never do anything that's going to jeopardize my patient's safety or something that has not been tested. I'm usually not the first person to ever do something, but I learned this technique from some surgeons in Brazil who've been doing this for a long time, who have lots of numbers and lots of follow-up. Just like with anything, in the wrong hands without proper training, it may not be safe. But this trend is here to stay. You see more and more surgeons doing it. It's just amazing. Every time I flip open the computer, somebody is training in rib remodeling.
Yes, and right now you're one of the few surgeons openly performing rib remodeling at Beverly Hills, and I feel like that's why it's so controversial.
Yeah. It's I welcome the controversy. I'm happy to sit down and talk about safety, my results with anybody. There's a handful of surgeons doing it now. I've actually taught a few others in Beverly Hills. I was one of the first people in California to be doing it, first in the United States, and I have some of the highest numbers of patients I've done it on. I've had no major complications. It's gone great. The patients are extremely happy.
And the girls are snatched. The before and afters are so wild. Do you want to break it down for the girls? What is rib remodeling and who kind of needs it?
Yeah. I always, there are some people who just naturally have a boxier waist. And no matter how much lipo you get, you can even do a tummy tuck, you just don't have that waist to hip ratio that you're looking for. And a lot of people just want, they may have a 29-inch waist and they'd be happier with a 26 or 25. So with rib remodeling, the ribs are not removed. They are only remodeled. And what I do is I make a small little cut in the rib with the same instrument that a rhinoplasty surgeon uses to cut the nose. It's the same instrument. It's called the piezotome. And I then fracture the rib. So it's a controlled fracture, not like you fell off your bicycle or a car accident. So it's very controlled with less pain than a traumatic rib fracture. Once that's done, you have to wear a corset for 3 months. That corset helps to mold the rib in place until new bone forms. Once that new bone forms, then you have your new small waist.
And I feel like a lot of girls out there, they want to get it done. They're seeing the trend, but they're hearing you're breaking ribs. And people are freaking out. Like, what do you mean? Don't we need our ribs to protect our vital organs? So when you use the term fracture and you're using such a small instrument, it makes it less scary.
It is, when you get your rhinoplasty done, they're breaking your nose. And then people say, does it affect your breathing? Well, if a rhinoplasty is done correct, it should actually improve your breathing. So when we are addressing rib remodeling, we are addressing the floating ribs, which are at the very bottom. Yes, they do have a protective role in that if you were to get punched or in an accident, they protect your spleen and your ribs, but we are not removing those ribs. We're basically moving them in a couple of inches. So they're still there in their protective role, but it's a controlled fracture.
And with the recovery process, besides the traditional lipo, do you think that's a little bit more intense? I know we have to wear a really tight corset. Do you think there's any difference in recovery?
I think it's a little bit more intense because you have to sleep in the corset.
Okay.
Lipo itself is, if you had it, it can be uncomfortable for a few weeks, but trying to wear a corset for 23.5 hours a day for 3 months, if you can't commit to that, you shouldn't do the procedure. But also, that's just not something that's comfortable. But it's part of the process and the result's worth it.
Yeah, and girls, if you're complaining about having to wear a faja and it's hot and it's uncomfortable, really second guess if you're going to be able to wear a corset, because that is 10 times worse in my opinion. And do you think, with the rise in snatched waist and Barbie-like figures, do you think rib contouring and remodeling is here to stay?
I 1000% believe that it's here to stay. I know just based on the number of people who are calling me, asking me for help and tips, and just seeing some even older surgeons in Beverly Hills, I see them going and getting training. These are surgeons who are well established, but they're having patients come in and ask for it, and they don't want to lose that opportunity or that patient. So I think it's here to stay. I don't see it going anywhere.
Now, you also specialize in body and breast contouring, from lipo to breast lifts and augmentations. What procedure do you think offers the most dramatic transformation for your patients?
Yeah, I would say in general, anything that if you're looking for ultra dramatic, it's probably going to be anything that has to do with the body. And that's usually going to be either a high volume lipo or a combination of a lipo and a tummy tuck for somebody who's got muscle damage from having kids.
Yeah.
You could have a small breast augmentation, you can have a large breast augmentation. It'll make a dramatic difference for you. But when you really contour the body with lipo 360, the front to back, that probably makes the biggest difference in my opinion.
Definitely. Now, for breasts, you do a lot of breast lifts, augmentations. What's the biggest misconception patients have about augmentations versus lifts?
Yeah. In general, one of the biggest misconceptions is I got a breast implant, I don't need to wear a bra. To me, that is the biggest fallacy or the biggest mistake patients make because...
And to be fair, I am one of those patients. I will be truthful here.
I get it. Bras I've never worn one personally, but I understand they're uncomfortable. And If someone's starting with like an A cut breast and they're getting a small implant going to B or a small C, they probably don't necessarily need a bra. But in California and places that do some large augmentations, those implants, a 400cc implant weighs a pound, and so that's just 2 pounds on your chest as you're walking and bouncing around all over at work or wherever, and that's going to continually stretch those tissues over time. And that's why you see more surgeons nowadays using some type of soft tissue reinforcement like meshes just for that purpose.
Now, back in the day, they were like, should we sleep with the bra? Like, is this going to help gravity? And surgeons were like, no, like you can't help gravity. They're going to fall. So do you think it's beneficial to maybe sleep with a sports bra, something soft, if you went from an A to a C cup or whatever?
Here's what I find is that a lot of people have submuscular implants. I do some under the muscle, I do some above the muscle nowadays. It just depends on the patient's wishes, desires, and anatomy. A lot of people will sleep on one side or the other. They'll sleep on the left side. And then when you get them in the operating room table, they'll lay on their back. You'll notice that left implant slides off of their chest because they've always laid on that side. So for you women with implants, go home, lay down on your back and see, do your implants stay where your surgeon initially put them, or are they going off to the side?
Oh my goodness. And I sleep on my right side. I wonder, your shit's going to be all the way on the other side.
Well, it's very common to have those slide off the chest. And so I do feel like wearing a sports bra at night does kind of help keep those where they are, because in America we use a lot of smooth implants. We don't use textures much as other countries do. So those implants can move around freely and they're more likely to expand that pocket. And that's why we do a lot of breast revisions.
So girls, you're hearing it first. We're going back to sleeping with a sports bra.
Well, you're just going to give us more revisions in business, I guess.
There you go. Now let's talk about the BBL. Now, we're not going to talk about, everyone thinks that if you're going to get a BBL, you're going to get this big video vixen booty shape. And yes, that is achievable, but you also offer a skinny BBL, which a lot of people are curious about because it's very different from the traditional BBL. Who is this best suited for? Patients with small BMIs, smaller petite girls? Who are you doing them a lot on?
Every day I get people who want something different. And the vast majority of women want something that looks natural, Nobody really wants... I mean, I operate a lot of moms. They have young kids. They're at school functions. Nobody wants to be the center of attention for the most part. I think each surgeon gets a different type of patient population. I get a lot of middle-aged moms, which is great. I do get people who are, models and on OnlyFans, and they're wanting something large, and that's fine. It's just that a lot of people may need 1 to 2 or 3 surgeries to get there. But patients with low BMIs are perfect for what I call the petite BBL, because a lot of surgeons will tell them to go gain 20 to 30 pounds.
We hear that all the time, and it's like, wait, what?
And if your surgeon needs you to gain 20 to 30 pounds, that to me is always a red flag, because just because you gain that weight after surgery, you now have to maintain it. Otherwise, you're not going to keep that fat. So you have to do surgery at a weight that you are comfortable with. A lot of patients will come in and say, I want to get surgery, get my BBL, and then I want to go on a diet and lose weight. And I say that's not the right approach, because you don't want to lose all that hard work that your surgeon and you yourself have obtained. So skinny BBLs is great for patients lower BMI. I specialize in BMI as low as 19 to 20, and those who don't want to gain 10, 15 to 20 pounds, and for those who've been told they don't have enough fat.
Now, touching on BBL maintenance, a lot of people and girls think they can just get surgery and never touch the gym again. And I've been preaching to the choir over here, but we are now going to hear it from a surgeon. How important is BBL maintenance?
There's a misconception that once you get lipo, you're done, the fat can't come back. When we do lipo, we never remove all the fat in any given area. And when you see these girls with those lumpy, bumpy abdomens, that fibrosis, that's usually over-aggressive, superficial liposuction. And so those patients who've gone, especially to other countries
That's what I was going to say. I've seen a lot of girls with what you just described coming from other countries when they're trying to do vigorous HD lipo.
They do it and it's over-aggressive. Now those girls, when they gain weight, they've basically been, lipo so thin, it usually doesn't come back there. I typically remove about 90% of the fat in any given area. I want the contours to look nice and smooth, so I lose some behind. If you do gain weight, you will see it go to those areas that are possibly left behind, and you'll see it go to your butt as well. So a lot of the large oversized butts that you see nowadays are patients who've had BBLs 5-6 years ago, and they've let their weight go. And all of a sudden now their butts are huge, and then they say, oh, I went to XYZ surgeon, and I know that wasn't possible with one round. So usually it's due to lack of maintenance. Now, when do people look good after BBL? I think a lot of people look good in that first month, the second month. As the swelling continues to go down, you kind of start to see your final result closer to 4 to 6 months. But if you never step foot in a gym, if you never practice good nutrition, you will not look as good 2-3 years from now as you did after surgery.
So things start to drop, correct?
They start to drop. Gravity never takes a day off, ever. So if you do not maintain, you will be back on the operating room table trying to fix something, and that's pricey. There's no need for that. It's just,
if you're able to do it on your own naturally, you don't have to come back and get on the operating room table. And I always tell women, like, your protein is so important. I know people hear it all the time and get your protein and take all this stuff, but in combination with strength training, and if you want good body composition, And to maintain your results, don't waste your time, don't waste your money, get good nutrition and good protein intake, I think is key.
Yeah. I always hear people say, well, after my surgery, I'm going to start working out. I was like, surgery's in 4 weeks. Well, let's start today.
Yeah.
Well, the better you look coming into surgery, the better you look coming out.
Yes, preach, because we hear this all the time, like, oh, I'm gonna get the surgery and then I'm gonna start. Like, no, sis, you gotta do your lifestyle adjustments. And I talk about this all the time prior to surgery, because your results will be 10 times better if you change your nutrition, you get your steps in, you're just with everything. That's so important. Now, do you find patients who treat their surgery as an investment in their lifestyle have better long-term outcomes? Like, I invested so much into myself that I am going to do everything I can from face to body to breasts, that their outcomes are typically better?
Yeah, I think the patients who get the best results are those who have done the research, because what I hear the most is people say, well, I had a BBL a few years ago, but I didn't do any research. I didn't follow any post-op instructions. I sat on my butt right away. I ate whatever I wanted, but this time I'm ready. This time I know what to expect. And so I think a lot of people think plastic surgery is like a one and done, and I got surgery,
And
I paid
that's
my
it.
money, and that's it. And so that is the wrong way to go about it. So
And then they try to come back and say, oh my God, you said my results would last 5, 10, whatever plus years. And look at it now. It's like, okay, well, what are you doing? What have you been doing?
yeah. And a lot of patients will come and say, oh, I had a BBL by so-and-so surgeon, and now look at me now. And I'm like, I know that surgeon very well, and I know that surgeon did great. And I'll ask, well, has anything changed? And they'll say, well, yeah, I gained, 15, 20 pounds. Well, that will certainly affect the result that you previously had. So, like going back to maintenance, it's so important. We all gain weight around the holidays. It wouldn't be a holiday for me if I didn't gain 10 pounds between December and January, but I get back on the wagon. I'm back in the gym. And I try to live somewhat of a lifestyle that I want my patients to live as well. You may see me cooking a lot of food on Instagram because I believe in, like you said, a lot of protein. And so
Practicing what you preach.
and so I try to avoid a lot of carbs, but I'm definitely going to maintain my protein just like I expect my patients to post-op.
Now, we're going to talk about J plasma, VASER, and high definition contouring. Now, you use VASER lipo in your practice. Can you tell the girls, because they go in just thinking about lipo, and then they come out of their consult and they're like, oh shit, the surgeon said they offer VASER, J plasma. What is this? What does it do? Why is it so much extra money? Do you want to kind of explain how it works and how it's different from traditional lipo?
Yeah, so I guess traditional lipo would basically be we put a fluid called tumescent in, which has pain medicine, and epinephrine, which helps decrease bleeding. You put that in, and then you start removing fat. What VASER does, and I use VASER on all of my liposuction cases, every single one it's included. VASER actually goes in and it helps to break up the fat so that it allows for smoother extraction. I see personally less contour irregularities because most of that fat has already been broken up from surrounding tissues and structures. I see better high definition when I use VASER, and so that is why I use it. Also, I don't get tired as fast because now that VASER has broken up the fat, I don't have to use as much manual shrink to remove it. And so when other surgeons are getting tired after removing 2 to 3 liters, I can do multiple X times above that because the VASER was helping break up.
Why wouldn't all surgeons want to use VASER lipo? Is the instrument just too expensive? Is the technique different? You have to learn this new technique, or what's the reasoning?
If you're operating in a surgery center that doesn't have it, so you don't have access to, and it is expensive. It is an energy-based technology, and just like with anything that has energy, there is a risk of injury to the patient if you don't know how to use it correctly. So somebody may have used it once and had a bad experience, and now they're like, I'm never going to use that again. So number one, I would say it's cost. Number two, it does add time to the case. On general, I would say I use a VASER for about 20 to 30 minutes per patient. And so I'm going for results at the end of the day. I want the best results. Some people are looking at the clock, counting the minutes to save money on their facility and OR fees. And they want to get in and out as fast as possible. And that's just not my mindset.
Now, who is the ideal candidate for VASER? What patients are we looking at for someone to get more definition, even if they're maybe not super lean?
Yeah, anybody that I'm doing lipo on is going to be a good candidate for VASER.
Okay.
Anybody. Where if I do lipo, I'm doing VASER. Sometimes if I'm doing around like liposuction of the chin and neck area, I won't use VASER there. But the arms, the body contouring, I'll use VASER 100% of the time. The only place I wouldn't use it is if I'm doing a tummy tuck, I'm cutting out that lower abdominal skin. I wouldn't do it there. Who's a good candidate for somebody that wants high definition? Well, somebody who already works out and has good definition underneath.
Okay.
Believe it or not, every time we do a tummy tuck, you can tell how much somebody works their core based upon how thin or thick their rectus abdominis muscles are. So when people come and they've never spent a day in the gym in their life and they say, I want muscles and I want lines here and there, you're basically creating the fake abs because there's really nothing underneath there. And if that patient ever were to go lose weight and those lines are not in the exact same place where the muscle
definition look crazy.
You may see 2 or 3 extra lines that shouldn't be there. So patients who have a good baseline physical fitness, they're not terribly overweight with a lot of loose skin are better candidates.
Have you seen anyone yet come in with like the high definition lines and then they're moved all of a sudden?
I have one of the worst cases I saw where somebody had actually gone to a different country and had gotten a tummy tuck. And so you gotta be careful when you're doing high definition with a tummy tuck, because when you bring the muscle in, those lines come in closer together as well. So they had the vertical lines placed, and then they had their tummy tuck, and basically the vertical lines were essentially in the midline because they had tightened the muscles so much. And so you got to be careful to respect anatomy.
Can you even do anything to fix that, or no? Once it's brought in, it's over.
Yeah, it's permanent. So it's not something to take lightly. I like to do high definition, but I like to do more of a moderate and soft. If you look at the cover of Elle Vogue magazine, you see models, you don't really see a whole lot of super high definition.
No.
So my thought is, if you're at the beach, you're at the pool, you've got your bikini on, someone should look at you and not say, oh, that's a lipo stomach. You can tell that.
Yeah. And I feel like in Colombia, they do a lot of high definition, and you know, the girls are on the OR table, and it's just like so sleek. They baby oil up, and it's like, honestly, in real life, when you're looking at it, it almost looks a little crazy.
Yeah, I mean,
in some cases, some doctors go ham.
And I think there's some cultural differences. There's some countries where women, they want that extra look, but for me, it's like, do your arms match your abdomen? You know, how can you have a really, really strong etched abdomen and then you have really flabby arms or really flabby leg? So the math ain't mathing. So that's what I'm taking into consideration when somebody asks me, you know, will I come out with abs? And I said, well, when was the last time you worked out? About 3 or 4 years ago.
Damn.
I don't think you're going to come out with really defined abs after this surgery.
Now, are you realistic with your patients if they come in and they want abdominal lipo, and you kind of look at their arms and they're like, hey, girl, like, maybe let's add in the arms? How do you start that conversation without kind of being nasty or mean?
No, I mean, every conversation I've had, I usually say, you know, I have large mirrors and I say, what is it that you don't like about yourself? And I like to leave it open-ended, so you tell me exactly what it is that you don't like. I'm not the type of person who's going to suggest other procedures unless I think that it's important to your overall well-being. There are some surgeons who are, oh, you add this or that.
They oversell. And
yeah, and for me, it's about, I want you to possibly have surgery one time, one and be done. And I don't want you coming back and say, oh, I wish I had done my arms. Like, if you can't afford the surgery, you can't afford to do it all, keep saving until you can. Because it will cost you way more to come back and just do your arms by themselves.
Because then you add them supplies and meds and surgeon fees and travel fees if you're from out of country or state, recovery fees. It adds up very quick.
So there are patients who say, well, what do you recommend? I would say, if this was my wife, my sister, my girlfriend, or whatever, I would say this is what I would be doing. I would go ahead and add the arms just for contouring, just to make sure everything else matches. And so my job as a surgeon is to give my best advice. I'll often say, we all know what the Olympics are. There's a gold, silver, and a bronze medal. I'll say, this tummy tuck with Lipo 360, that's going to be your gold medal. The silver medal will be liposuction with possible skin tightening. The bronze medal might just be liposuction alone. So nothing wrong with the silver medal, but everyone shoots for the gold. And so I had to tell you what I would recommend for my own.
The way you break it down like that is so easy. I love it. A lot of surgeons don't do that.
Well, I just don't want people to come back and say, oh, you were right. I wish I had done what you had said. I wish I had done that tummy tuck. Now I have loose skin. And that's important for patients to have options, because, you know, I say it's a decision that you make. It's your body. You're going to wake up and live with it every day. You and your significant other come together, figure out what financially makes sense for you and physically, because I don't want you to be unhappy and come back later. I will say one thing. If somebody has a lot of loose skin and they go and do lipo, especially lipo is like plasma, if they decide later they want a tummy tuck, it's extremely difficult to pull down that scarred in skin. And so if you don't do a tummy tuck when you should initially, then oftentimes you're going to be left with a vertical scar, which you may see above your tummy tuck. And I find that those patients may have a harder time healing their incision because there's so much tension from trying to pull down tight, and you just don't get as good a cosmetic results. So if you have a lot of loose skin, then liposuction without the tummy tuck sometimes can be damaging to your future prospects.
It's more beneficial if you don't have all the funds, you know, don't rush the process, wait, and it's better to get lipo and a tummy tuck at the same time for a better outcome.
Yeah, and you know, I respect a few surgeons around town, because what I've seen them do in patients who they know need a tummy tuck, they'll lipo great on the back, great on the sides, but then they'll leave actually a lot of fat right here. And I've never spoken to them about it, but I think they understand these patients need a tummy tuck, and they're making their future tummy tuck a lot easier by leaving a lot of fat.
Because they know they're probably going to come back anyways.
Exactly, 1000%.
Smart.
Yeah.
So let's talk about J Plasma. You used to offer it and now you don't. What is going on?
J Plasma has been around for quite some time, and I think in select patients, I think it's a good option. I personally, I have the machine, I have the technology, but I have shied away from using it as much because I just wasn't as happy with the longer term results. I think everything looks good for a few months, but after that, I just didn't see long term really good results. And so I was introduced to a device called retraction, which uses some similar radio frequency technology, but to me, it doesn't require the helium. less risk for me of seeing any skin damage or burns. And so I've used that for, like 2 or 3 years now, and I've been really happy with the results. I even used it on Jasmine. So that's my preferred take. The question is, some people think everybody's a candidate for skin tightening. And if you have enough skin that can be removed with a tummy tuck, you probably shouldn't be getting that product. And I know a lot of surgeons will tell you, hey, you can.
I was just going to say, a lot of surgeons are selling J plasma. We're going to charge you $5,000 extra because we're going to tighten that skin. You need it.
And what's unfortunate is, in order for this technology to work, you have to apply a certain amount of energy for a certain amount of time for it to work. 'Cause some people I've seen, they'll just go in and a little bit, say they've done it, and you will get no result from that. And now you spent $3, $4, $5,000 for that extra tightening.
And sadly, the patients, you're asleep on the table. You don't know how long the surgeon did it for, if they even remembered to do it, and you don't know.
If I'm applying energy to the abdomen, that takes me an extra 20, 25 minutes sometimes. The arms,
And I will vouch for him. I've been in the OR with Dr. Marshall, and he truly does take his time. You are getting your money's worth.
I mean, how long was you out in surgery,
A long time. But her results are amazing.
So I think when the correctly selected patient, it's a good technology, but it's not something for everyone. And I would just say, use it with caution. Don't just think, oh, I'm going to get perfectly tight skin. Because in the best case scenario, you would see maybe upwards of 25 to 30% more skin tightening than without it. Lipo alone, it's just, when you do lipo, you'll see the skin shrink. It inherently will shrink about 8%. With the skin tightening, you may see an upward extra 20 to 30%.
Now, what about combining VASER lipo and J plasma? Are the results even better?
I think using anything with VASER is just could help my results so much. I see people who have gotten VASER and people think, did you do skin tightening? Because it comes down to how good your skin is. If you have good quality, thicker dermis with minimal stretch marks, you're going to get good skin retraction without any added skin tightening devices. I think when you look at the South American women, they have a lot of African mixed ancestry just based on slave trades and things like that. And they have really thick collagen in their skin. So you see a lot of good results coming from those patients. People with lighter skin, paler skin, thin skin, typically don't see those good skin tightening results.
And would you say those type of patients are more at risk for complications with J plasma?
I wouldn't. I'd say it's based upon the surgeon that's holding the tool.
Yeah, and that's hard to dictate when you're in a consultation and they bring up J plasma. You don't know how experienced that surgeon is with J plasma. And that's why sometimes we see way more complications than outcomes.
Yeah, I mean, this is an energy-based device. It is delivering energy to the skin. The same energy that we use from the bovie is very similar to the plasma energy. And so if you don't have enough tumescent fluid underneath the skin, you can burn the skin. If you're not applying the energy correctly, you can cause a complication. One of the worst complications I've seen, it wasn't my patient, but as a result from plasma, is using it on somebody who needs a tummy tuck, because that skin doesn't always lay down flat afterwards with your foam and your faja that you're wearing, and so the skin becomes like matted up and wrinkled up, and then it just becomes hard and fixed and firm, kind of like an orange peel that's just been sitting out in the sun. So those patients tend to get they need like a tummy tuck, and it's really hard to do that on later.
Now, we're talking all this surgery talk. We need to talk about post-op. We have so many patients that are not reading their post-op instructions. And we say this over and over and over again. And they think that they can go to YouTube or watch a TikTok series and they're automatically going to know everything. And please tell the girls that they are wrong.
So if you choose a certain surgeon, you chose them for a reason. So listen to their advice. I give a lot of patients a lot of paperwork, and it tells you, when to shower, when to start working out, when you can have relations with your partner. And then patients will often email or call and say, when can I do X, Y, Z? And that usually tells you this patient has not
Did not read anything.
The patients who are well-versed in everything they're supposed to do post-op, I notice they get better results. Their incisions look better. They keep more fat where they're supposed to. Their lipo, everything just looks better. I've had people go straight from liposuction surgery or whatever and go to McDonald's and grab, a fried chicken sandwich or whatever.
And, I'm honest with my patients, especially when we're taking care of them post-op in recovery. And they're like, hey, I think I'm just going to DoorDash Chick-fil-A. And I'm like, girl, you just spent how much money on your lipo and you're ordering Chick-fil-A? Like, you must have lost your damn mind.
I've had patients, we give you, based upon how much fat I remove, how much I put back in, I'll tell you exactly what weight I want you at during surgery. It's a little pink card inside your folder. We give it to everybody. And it'll tell you, you come back and you're 5 pounds down and you say, where's my hips? I lost my hips. And I look in your folder and it literally tells you the weight goal that we had for you. I had one patient gain 20 pounds in like 8 weeks because, we say at most gain 1 to 2 pounds post-op.
20 pounds in 8 weeks?
She thought it was she was supposed to gain 1 to 2 pounds a week, even though her weight goal was right there in her folder. So patients not reading or following instructions, that could be your own downfall. We don't want that. You spent way too much time and money, pain and recovery. We want you to get the best results.
100%.
Avoid going to the Facebook groups, because if you have a problem, contact your surgeon. If you have a question, contact your surgeon.
And everyone's journey is different. You can't compare yourself to someone else's surgery journey. They will have a whole different lifestyle than you. They'll have a whole different social, everything than you. So you really have to pay attention to the post-op instructions your surgeon specifically gave you, because hey, it might be different than his next patient. You never know. And if you need to clarify questions, call the office, send an email. It's that easy. You guys just really need to take initiative and make sure that you follow everything you're supposed to have the best outcomes.
Preach.
Yes. Now, last thing, realistic expectations. You know, patients, we say this all the time. We try to say it in a nice way. They come in and they show a picture. We'll use Kylie right now because she's going viral. I want the breast of Kylie. And it's like, hey, sis, you're shorter, you're taller, you're wider, your frame's totally different. You can't, please let them know.
So when you have millions and billions of dollars, everything that is posted on your social media will look dang near perfect.
Yes.
These people have the best editing teams. They have
Lighting, cameras.
lighting, etc. We're in Beverly Hills. We're in LA. Operating on a lot of celebrities. I see everything. And all I can say is everything that you see online, when these people look just like any other human being, when you get them without all those filters and lighting and everything else.
And you see them in person.
Exactly. So a lot of, I see a lot of people that follow, and it's fine. They follow influencers. They follow models. I like her body. I like her body. But you have to be realistic. If you're showing me somebody who's 27 and is
No kids.
no kids, never had a tummy tuck,
Works out.
and you say, I want her body. Well, what is it that you really want? Because there's a reason why she is who she is. I'm never going to be 6'8". I'm never going to play for the Lakers. I'll never be LeBron James. I've accepted that, I understand what I was given, and I use that to my ability. And so we're not all going to be born to these supermodels. That's just what it is.
Yeah.
It's fine. I think it's fine to follow them, but I wouldn't idolize them. And I always say you should become the best version of you. We can move your ribs around, we can do lipo, but I wouldn't say I want to look just like somebody else.
We're not changing who you are. We're enhancing what you already have.
Yeah, absolutely.
And that's hard for a lot of patients to wrap their head around. They literally think you guys, which you are magicians, but they think they can transform them into a whole different person. And we can only enhance what you have.
I would say this is one piece of advice I'd give you is if you're going to a certain surgeon, don't bring another surgeon's wish pics as your wish pics.
No.
That's the worst thing. I said, if you like that surgeon's work so much, go to him. Well, I can't afford them. Well, that it kind of irks us a lot. So if you want to come to me, we'll show us people that we've done that we like, because we all kind of have our own style. What I actually do is I don't encourage wish pics. What we do now is we print off your pictures that we take pre-op, and we have you draw on them to show me what you're looking for. I've even taken a step further. I have them use a photo editing app. It's called Facetune. It's free to download, and we'll give you the photos, and then you go around and play with that and move your waist around, move your hips around, and then you send them back to us before surgery. So I have those pictures to look at. That, to me, you editing your own pictures of how you want to look is better than you bringing a picture of the Kardashians in.
And not a lot of surgeons do that.
I don't know anybody.
They say bring in a couple inspo photos, bring in a mood board, but no one is telling you sit down, look at your body, and draw and fix what you don't want.
Yeah, I think it's important because you're looking and saying, wow, most people don't realize how they actually look.
No.
A lot of people are afraid to walk past the mirror, lift themselves. But now you're forced to look at where you're starting. And then based upon what you do, I can tell you if that's realistic or not. And it said, well, if you want your waist this small, we may have to do rib remodeling. If you want your hips this big, then we may take 2 rounds. And so I think that's important so that we're on the same page. Just when you get your breast dog, most people do sizers nowadays. They do some type of 3D imaging. We really don't have a lot of that for BBLs, body contour, and that's why I have the patients participate in that process.
That's so awesome. I love that. And hopefully more and more surgeons use that technique. And I feel like the patients will have better realistic expectations.
Absolutely.
And especially seeing from what they're starting with, because you can always pull back the photo and be like, hey, sis, look right there.
And they always send the pre-op photos home with you too, just so the question.
So you don't forget where you came from.
I said, hang that on the fridge. So no more late night snacks.
No.
It'll deter you.
And what is the best way for patients to reach out to you in your office and team and book a consultation and get in?
Yeah, we make it very easy. I think one of the most common things we do is you can just go to our website and click the virtual consultation link. That's no charge for that. Basically correct your history, you submit 4 photos. I look at all of those. I give recommendations to my team, and then they call you and you basically have a phone consult with them. If you want to come in for an in-person consult, that's fine as well. There's a small fee, and you just call the office number on our website, and we'll get you scheduled a consult.
Awesome. Super easy. Well, Dr. Marshall, thank you so much for coming on All Things Plastics podcast and sharing your education with us and answering questions for the girls out there. And if you guys want to check out Dr. Marshall's Instagram and all his great work, you can head over to his website or his Instagram. We'll definitely be linking that so you can see all the amazing work he does and all the transformations. You post a lot of good ones. A lot of mommies out there getting snatched up.
I like to post the really large, big transformations, Because to me, like a lot of surgeons will post like a lot of easy cases, straightforward. You start seeing the same thing over and over, but you really can't assess someone's skill until you see the complexity to which they can do.
And you just posted one today or yesterday. It was a crazy transformation. What was it? A mommy makeover?
Yeah, and so I do tummy tuck, BBL, breast lift implants. But I want to, if you can transform that, then certainly you can do a lot more easy cases. And so that's why I don't post a whole lot. I like to wait until it's something that's like, okay, wow, this is.
Yeah.
So I don't want to just flood Instagram with a bunch of just, simple, easy cases.
Simple
Come in,
cases.
I'll show you the iPad. You can see hundreds of everything that we do. But for the gram, I like to stick to more complex pieces.
Yeah. Well, your work is amazing, and Jasmine looks amazing as well. So thank you so much for coming on. With pleasure. You guys, we will talk to you next week. Thank you. Bye.